Pigmentation is one of the top 2 concerns that we deal with at our clinic and have for the past 15 or so years. We have used every laser device out there and every wavelength trying to treat it.
And this has become a big part of our practice. We give talks about lasers and aesthetics, and how we treat pigmentation with lasers has become one of our favorite talks, partly because this is personal, it affects me, and I know lots of people that this does affect. But more importantly, most patients have some element of pigmentation that they want to have treated, but they don't know how to treat it, and lasers are the best way to do this.
So I said that pigmentation was one of the top 2 concerns. The other one is skin laxity. I think probably worldwide, pigmentation is one of the biggest concerns, and I think that's because it affects all of us. So you, yourself, you're never gonna have concerns with skin laxity. However, I will. And I'll also have pigment, you'll only have pigment. And I think that's why it's so common, is it stretches across all ethnicities. It really affects everybody, but in different ways.
For those of us who have practices in North America, we tend to focus a lot on skin laxity because patients who have lighter skin types will primarily be more concerned with skin laxity. But everybody's concerned about the color of their skin and the irregularity of the color of their skin. And for patients who are of darker skin or skin of color, this is actually the primary concern that they have.
50% of the aesthetic population that comes into our practices has one sort of concern with pigmentation, whatever that be. But again, what really is pigmentation? Like, we had somebody say to us the other day as we were talking about this talk and sort of reviewing it, and he said, I don't even know what pigmentation means.
Yeah, it really is a term that for some people, it doesn't really mean the same thing as other people. And in fact, I believe that more than 50% of our patients have concerns with skin color and pigmentation. They just don't really know how to verbalize it, nor do they know that there are really good treatments to help with it.
So let's break down pigmentation. Let's just straight out explain what it is, because it's impossible to be a provider and treat something if you don't really have a definite understanding. And the same way, if you're a patient, it's sort of impossible to figure out or know or believe what treatment you need if you also don't understand. Just having somebody say, I've got pigmentation, is like being on a dating app and saying, I've got hair. Okay, well, is it black? Is it white? Is it long? Is it short? Is it curly? I think you really have to break down what pigmentation is. And so we've broken it down into 4 different categories. First one being melasma. Melasma is a condition. It is a hormonal condition, mainly affects women, but we've had men in our practice with melasma. It's exacerbated by things like stress, sun, heat. Patients could even just go in and have a hot yoga session and their melasma will flare up.
Yeah. The second is PIH, or what we call post-inflammatory hyperpigmentation, which is a type of color problem that comes on after an injury, which could be a treatment actually. And this tends to affect patients who are skin of color more so than other patients. But importantly, just like melasma, it's really important to understand how these problems happen and how we can treat them safely, because the same treatments that we use to help these problems can also, if they're not done correctly, exacerbate those 2 problems.
The third topic or sort of definition within pigmentation is dyschromia. This is that basic sun damage that we all will experience just from lifelong sun exposure. Might show up differently in somebody with, say, your skin than it would in me, but we all have it, and it's just multi-layered pigment caused from just age and sun damage.
Yeah, and I think of this as the dirty window effect. As our skin gets older and accumulates damage, we just don't see its natural color come through as well. And so some of the treatments that we really use to treat dyschromia and treat it well are meant to clean out that window and let our natural color come through.
And then redness. Why did we put redness within pigmentation?
Because people typically think about pigmentation as brown. You think it's synonymous with the term brown, but it's actually not. When we're talking about pigmentation and pigmentation problems, what we're really talking about is how do we bring out the natural color of a patient, no matter what that color is. And as we know with color, really, color is affected by everything that's in the skin. So whether there's brown pigments or red pigments, it's really the balance of all these different pigments that bring out our natural color. So if somebody has a problem with redness, whether that's rosacea, erythema, or telangiectasias, or blood vessels that are really dilated, it is going to affect their perceived natural skin color. So we have to treat redness as well when we're talking about pigmentation.
And the term pigmentation, little educational tip here for you, actually comes from the Latin verb pingere, which means to paint or color. So it is all linked together.
It is. And this is the analogy that I give to my patients about dyschromia causing our color problems. It is the dirty window effect. Skin is all about transmitting light, reflecting light, and how we see color is really how light interacts with our skin. When our skin has an accumulation of aging byproducts, whether it's through sun damage or natural aging, it doesn't transmit color the same way it did when we're younger. So it's like looking through a dirty window. And this is really an important analogy because we need to clean out that window just like we need to resurface skin. And that will bring out our natural skin color better for a lot of our patients.
So now that we all understand pigment and that there's different types, different levels, how do we treat it? We treat it with lasers. We broke up lasers into ablative and non-ablative. So to start off, we're using our non-ablative wavelengths. These are things like the BBL and the MOXIE. These devices are made to hit that superficial melanocyte right up at the epidermis, and they do a great job with it.
Yeah, these two devices are expert devices at addressing pigment that is superficial in the epidermis. So when the problem is in the epidermis or very, very superficial, these devices are our go-tos for addressing it.
And they allow us to address it and still maintain a really minimal, if any, downtime for patients, which is a huge factor to consider when treating anything with your patients.
Yeah. The halo is our next laser, and this is a laser that can penetrate deeper into the dermis, into that mid-dermis. So when the pigment problem extends into that dermis, then we have to go with a laser that extends deeper than just the epidermis, and that's the halo. And so that's a great laser for addressing deeper pigment problems,
while still maintaining fairly minimal downtime, as opposed to, say, the next topic of lasers or the next type of lasers we would use, which would be the full ablation. And I think a lot of people don't think about full ablation when they're thinking about trying to treat pigment. But what ablation does is it really turns over those layers of skin, whether it's deep or a little bit lighter, and with it comes the pigmentation or the pigmented damaged cells.
Yeah, ablation is something that people typically don't think about helping with color. We will show you later in this presentation cases of ablation that clearly help with color. And it is exactly as you say, it is really turning over some damaged skin and allowing our skin to regenerate in a healthy manner. And again, that's going to transmit light better through our skin and help with the regularity of our color.
So we talked to you about pigment, explained to you, hopefully you all understand what it is now, and then we talked to you about the types of lasers we can use. So let's put it together and let's go through some cases.
Yeah, so this is our first case that we're showing. And this is a 60-year-old patient who has color problems related to age and sun damage, what we call dyschromia. And now, like many of our patients, this patient doesn't want an aggressive treatment. She wants something that can fit into her lifestyle and have a regular maintenance type of treatment. And this is exactly what the broadband light and the MOXIE are designed to do. These are devices that are going to address that superficial pigment that is really in that epidermis and that upper dermis. And it's going to be a treatment that doesn't have much downtime. It can be repeated. Some people will call it like a lunchtime laser facial because you can go about your daily business. but it's something that we do regularly, and this is a great result after 3 treatments.
Sometimes you can do a BBL and it is 0 downtime. It's no different than coming in for a facial. So it's actually a really good treatment to get rid of unwanted pigment as well as continue to prevent that pigment from coming to the surface. Because a lot of this type of sun damage is from decades and decades and decades ago when we used to bake in the sun. It wasn't from last weekend I forgot to wear my sunscreen. So we can do a laser treatment, but you're constantly going to have that pigment coming up. So something like a BBL gives no downtime and you can maintain that skin that we've given you.
Yeah, and the vast majority of our patients want a treatment that fits into their life. Even though, and as a surgeon, I'll tell you, I love aggressive treatments. This is what my whole career is about. But the vast majority of patients want a treatment that fits into their life and doesn't affect their life. And that's great. And this is what this treatment allows people to do.
Yep. Case number 2. This is a difficult case. This is a darker patient, darker skinned patient, darker Fitzpatrick as we would call it, with melasma.
Yeah, this is a Vietnamese patient who's had problems with her skin. She's had problems with melasma. Now, she's also had bad experiences, right? Which commonly happens in our patients who are skin of color. They will have a treatment, it'll exacerbate their pigment problems, or in fact, make it worse when it wasn't worse. And they come away believing that lasers aren't for them, right?
And that's what she said. She came to us and said, I don't want laser. She was concerned with her pigment. It was out of control, and she had had a laser. It made it worse, and she was absolutely petrified of lasers. The second part of it for her is that she owns her own nail salon and works 6 days a week and could have 0 downtime. So how do you treat somebody with a darker skin with a condition like melasma and no downtime?
Yeah, you need to have a device that is safe in patients who are of darker color, safe in melasma, and learn how to use it. Because as we know, you can take any device that's safe and use the wrong settings. But this is, again, a great example of where the Moxie shines. So this is a device that's used for a patient who's both dark skin as well as has melasma. It can be used safely. We need to have recurrent treatments, but it can affect her pigment and really smooth out that color.
And that's important to point to. I think you said recurrent treatments because melasma is a condition. You need to regularly do your treatments to keep it under control, to keep it at bay. And you can with the Moxie because, again, it has such minimal downtime.
Yeah, and this patient highlights the 2 great myths of laser medicine. That A, you can't laser a patient who's of skin of color, and B, you can't laser melasma or a problematic pigmentation issue. And those are issues that we know that you can absolutely treat these patients and these conditions with lasers, but you just gotta know how to do it properly and safely.
Case number 3. This one's awesome.
Yeah.
This is probably one of my most favorite. So this is a patient, she was a weight loss patient. So she had pigmentation concerns just from years of sun exposure, but she also had a massive weight loss.
Yeah, and what that causes is when patients have a large weight loss, whether it's through Ozempic or gastric bypass surgery, or if they just lose their weight on their own, it can affect skin laxity. So the structural architecture of their skin changes. It physically changes. They don't hold structural strength as well. The thickness of that skin is not as good as it was previously. And what you get is this gestalt of problems. They have skin laxity, they got pigment problems, they got textural problems. All of them are related, aren't they?
Mm-hmm. And so for her, we had to get deep down into her deeper tissues to really stimulate collagen to tighten things up to improve that laxity. But we also had to clear out that pigment. And for her, her pigment was at multiple levels. And so by combining the ablative with the non-ablative, we could sort of give her everything that her skin needed.
Yeah, and this case highlights another concept that we introduced to people, which is stacking lasers. Many times we're trying to achieve multiple goals with our laser treatment. And to do that properly, we want to use different wavelengths. And so we can put them together with combination treatments or what we call stack treatments. So this is a Moxie profractional stack treatment. What the Moxie does, it lets us address the superficial pigment, But then what the profractional ablative treatment does with the deep erbium ablation is that we can really get to the deeper parts of that dermis, build up the strength of that dermis, turn that skin over, improve texture, and thicken that skin. All of that is going to end up with the net effect of improving color.
And she looks incredible. She's smooth, she's bright. We were talking earlier about what makes skin healthy or refreshed. This is the exact example. She just looks younger and healthier.
This is truly one of our, I think we say this is our favorite every time we show one of our patients, but
pretty impressive.
This is actually, I think, one of our true favorites, all-time favorites. And this is a patient who's a beautiful woman in her 60s who had never done any treatments for her skin when she came to see us and had problems with dyschromia, color, redness. All of these issues were problematic for her. And so we've done a series of treatments. She's had a halo as well as a deep ablative resurfacing. And again, what we're trying to do is clean that window. That window is really dirty, obstructing light. It's not letting her natural brightness shine through. And when we do a deep ablation and add in a halo, you can see what it's done for her overall color. So we're not trying to address pigment in isolation. What we're trying to do is regenerate skin, resurface, get it to be healthier, and let that natural light come through and let their natural skin color shine.
And you really have to do that at multiple levels. And that's why we stacked these two devices together. You've got the diode and the halo that can hit a bit more superficially, and then we stacked multiple different erbium lasers on top of each other to just, like you said, clear out that tissue. And with it comes pigment and all the other concerns of old damaged cells.
And now this case, this is our last case that we're showing you.
We save the best for last. It's like when you have dinner and you rush through dinner to get to dessert, because this is the best case.
Yeah, and when we talk about pigmentation and we give this talk and talk about pigmentation problems, this is really probably one of the most difficult cases that somebody who specializes in laser aesthetics is going to come across. Really, she's got all of the features of somebody who's going to have a difficult problem and have potentially not a great outcome.
Because she has every skin concern. She has every skin concern. She's a darker Fitzpatrick naturally. She has uneven texture. She has different types of pigment. She's got darker pigment, hypopigmentation, raised lesions. Did I miss anything?
She's got melasma.
Melasma.
Yeah,
we got it all.
She's got underlying vascularity, so you wouldn't necessarily think so because you look at that picture and you just see somebody who's got darker or brown skin. But when you look at her images reflecting the vascularity, you see that really she's got an underlying vascularity issue as well. So she's got the royal flush of skin issues as it relates to improving pigment. Not to mention, deathly scared of lasers. Again, as many patients who are skin of color do when they come to see us, the first thing out of her mouth is that I was told never to laser and I'm scared of them.
She's also a patient that came to us post-op day one after abdominoplasty with a full face of makeup. And so that's what got us talking to her about lasers. And
this is a stack treatment. So in these scenarios where somebody's really got complex problems, using multiple wavelengths is the preferred way of trying to treat this for us, because we can take these complex problems, use multiple different wavelengths, and be able to use them each safely in order to address a lot of different issues in one treatment, which is exactly what we did in this patient. So we use the Moxie, we use a halo, and we use the erbium all in one treatment. And you can see her results. She's had a spectacular result. Her melasma is better, her overall pigmentation is better, the texture is better, those areas that were raised are flattened now, and even the areas of hypopigmentation have darkened. Not to mention her underlying redness has changed as well. So all of that smoothed out, and her overall color is more uniform and it's brighter. So her natural skin color, the vibrancy of her natural skin color has really come and shine, which shows another issue, which we always say. For these patients who are darker skin, it's not about making them lighter. It's about letting their natural skin vibrancy show.
And if you can understand pigment, where it's sitting in the tissue, and you can understand these different devices or these different wavelengths, you can really treat, as we've sort of demonstrated, pretty much any skin concern. You can make improvements for any patients. And these Cyton devices have really changed our practice and how we are able to treat all types of patients.
If I was looking in the mirror and I'm concerned about pigmentation, what should I do about it?
You should book in for a consultation with an experienced provider, because you're absolutely right. Even though we just stood up here and we tried to explain pigmentation to you, you can look in the mirror and you can say, well, I don't know, is this melasma? Is this just dyschromia? You really have to make your way to an experienced provider and just talk with them. If you ever go into a clinic and they say, you've got to book right now and this is what you have to do, walk away. You should be able to go in, you should be able to talk with a provider. They should be able to educate and explain things to you. You can take that home, do your own sort of research, which is what I say to all my patients at consultations, and then come back and focus on a treatment plan together. So as you can see, pigmentation is very complex.
Yeah, and when we talk about pigmentation, we talk about color, remember, we're not talking about changing somebody's color. What we really are talking about is learning how to bring out the natural vibrancy of your own color and using these devices to smooth out and treat any irregularities.